Welcome, ladies and gentlemen. My name is Stanley Samsodza, and I'm going to take you through leadership and management. Today, we are going to look at November 2019 GNC qualifying exam. We're going to look at Section B, Section C, and Section D. Section B, we're going to look at the matching. So we'll be reading out the corresponding answers which were expected in this paper. Question 51, column 1. 51 is controlling, which matches with part B, which is evaluating the progress against the plans and making corrections either in plans or execution. So this is controlling. Question number 52, conflict management. It corresponds with item F, which is systematic process to find a satisfying outcome between conflicted parties. Question number 53, quality assurance. It corresponds with item A, which is organizations guarantee that the product service it offers meets the accepted quality standards. And question 54, leadership. It corresponds with item D, which is the driving force in people to carry out their role. And question 55, lobbying. It corresponds with item C, which is the process of influencing public and government policy at all levels. In this particular section, these are the answers which were expected. Match the concepts in column 1 with the definition in column 2. Number 56, quantitative. It matches with item D, which is using numbers, whereas qualitative is the use of words. So quantitative, use of numbers. Number 57, stockouts. It corresponds with item G, which is having no supply of an item in stock. Number 58, resupply site. It corresponds with item E, which is location that receives supplies from the district. Number 59, commodity security. It corresponds to item H, which is having enough to supply everybody. Number 60, allocated stock. It corresponds with item B, which is reserved product. These were the expected matching answers for number 56 up to number 60. Then we move on to matching from number 61 up to number 65. Match the following principles of management in column 1 with their descriptions in column 2. Number 61, stability of tenure. It corresponds with item D, which is the period of service should not be too short and employees should not be moved from positions frequently. Number 62, order. It corresponds with item C, which is material and people should be in the right place all the time. 63, scalar chain. It corresponds with item B, which is superiors ranging from top management to the lowest rank. Number 64, unity of direction. It corresponds with item A, which is all those working in the same line of activity must understand and pursue the same objectives. Number 65, unity of command. It corresponds with item G, which is the subordinates receive orders and accountable to one superior at a time. So these were the responses which were expected for question 61 up to question 65. Now we move on to question 66 up to question 69. Match the concepts in column 1 with the statements in column 2. Number 66, cost-benefit analysis. It corresponds with item D, which is approach that attempts to relate the direct and indirect cost of policies to the direct and indirect benefits of those policies. Number 67, case studies. It corresponds with item G, which is it represents a fundamental phase of the research process. Number 68, cost effectiveness analysis. It corresponds with item A. Item A, which is it addresses the cost of different policies in achieving the desired policy results. Cost, it corresponds with item H, which is the value of resources used to produce services. Number 70, cost utility analysis. It corresponds with item F, which is an approach that attempts to compare the costs and benefits of healthcare technology. So these were the expected response for question 66 to 70 for matching. Section C, complete the following statements with the missing words. In this particular section, I would encourage students to also verify, especially on individuals who hold positions, as some of these positions, they change. So it is recommended that you also check with your text as well as other reputable references. Number 71, dash is the force that drives someone to achieve. Number 71, it's motivation. Number 72, the president of the General Nursing Council of Zambia is? The answer is Dr. Lonia Mwape. Number 73, dash is the ability to make the best use of available resources in the process of achieving goals. The answer is management. Number 74, under the climate of morale, what is the result of the broadening the interest of the individual to include the whole group? Number 74, the answer is increased productivity. Number 75, dash is the process of finding and hiring the best qualified candidate for a job opening in a timely and cost-effective manner. The number is recruitment. 76, the answer is human resource information systems is a form of consulting service which enables the employer to obtain a comprehensive insight into personal affairs. Number 77, training that is expected to produce specific character or pattern of behavior, especially training that produces moral or mental improvement, is called discipline. Number 78, the introduction of new process in an organization or the management of people who are experiencing change is called change management. Number 79, the Chief Executive Officer of the General Nursing Council of Zambia is Dr. Aaron Banda. Number 80, the process of working through details of a problem to reach a solution is known as problem solving. Number 81, the current Minister of Health is Dr. Chitalu Chilufya. Number 82, dash describes the level, scope, and depth of the desired quality of 7, quality management. Number 83, the tool of vehicle, The tool or vehicle for transmitting information in the word is called internal memo. Number 84, the type of budget that prepares expensive items or equipment is called capital budget. Number 85, the obligation to complete work satisfactorily and use authority appropriately is called responsibility. '86. The informal methods of communication that coexist with formal channels is called grapevine, more like gossip. Number 87. The phase of change that makes people to be aware of need to change is called unfreezing. Number 88. A clash between two opposing parties or ideas is called conflict. 89. The process of converting data into the format required for a number of information processing needs is called encoding. Number 90. The leadership style, where a leader takes all decisions and assigns all responsibility to himself, is called autocratic leadership. Number 91. The type of motivation where there is inner gratification and feeling of fulfillment is called intrinsic motivation. When taking inventory of the word, it is necessary that you as a nurse manager understand the quantity of usable stock on hand at the beginning of a given time period, which should be equal to the closing stock of the previous period. Budgeting involves planning for money, manpower, and time. The other missing space is for assets or equipment. The branch of economics concerned with issues related to efficiency, effectiveness, value, and behavior in the production and consumption of health and healthcare is called health economics. Number 95. An ongoing continuous process of communicating and clarifying job responsibilities, priorities, and performance expectations in order to ensure mutual understanding between supervisor and employee is called performance review or performance appraisal. Performance review or performance appraisal. Number 96. Documentation encourages nurses to assess clients' needs and determine which interventions are effective and ineffective, and identify and document changes to the plan of care as needed. The answer there, which was needed, is needs. Number 97. The in charge for medical ward views her nurses as individuals and aims at making friends and influencing others using a human approach to human problems. The in charge here is actually using the collaborative approach to supervision. These were the expected answers which were required for number 71 up to number 97. Number 98. A general plan of action used to guide the desired outcome is known as a strategic plan. It's more general. Number 99. What is the name of the person who developed the scientific management theory, which proposed careful specification and measurement of all organizational tasks? The answer is Frederick W. Taylor. Frederick W. Taylor. Number 100. The management principle of unity of dash is when the entire organization is moving towards a common goal and direction. The management principle of unity of direction is when the entire organization is moving towards a common objective and direction. These were the expected response for question 71 up to 100. Earlier on, I'd said up to 97. I'd missed out the last 3, which have just been addressed. Now we move on to section D, which is the more interesting, where we have the long essays. Section D, essay questions. There are 3 questions in section D. Answer 2 questions only. Question number 1 is compulsory. Each question carries 100 marks. Ladies and gentlemen, this is one of the most important sections. As you can see, you have section D, which has got 3 questions, and number 1 is compulsory, and you need to answer 1 more optional, and each one carries 100 marks. If you look at section A, section B, and C, you find that they all cumulatively have got 100 marks, meaning to say this is where you need to get your 200 marks so that you can have your total of 300 marks. Question 1. Registered nurses have expertise in general activities of any ward and mostly work as ward in charges. Therefore, as a senior staff in an organization, the nurse should be very familiar with the 3 levels of management and logistics management in an organization so as to be more efficient in his or her work. A. Define management. 5%. Management is defined. I'll define management as management is the process of planning, decision making, organizing, leading, motivation, and controlling the human resources, financial, physical, and information resources of an organization to reach its goals in an efficient and effective manner. So the key words that we have here is management is a process. It's not an event, but is a process of planning, decision making, organizing, leading, motivation, and controlling. On controlling, what are we controlling here? Controlling the human resources, the financial resources, the physical resources, and information resources of an organization to reach its goals in an efficient and effective manner. I will repeat the definition of management. Management is the process of planning, decision making, organizing, leading, motivation, and controlling the human resources, financial, physical, and information resources of an organization to reach its goals in an efficient and effective manner. We move on to the other part. List the 6 rights of logistics management. The first one is you're supposed to have the right goods. Second, right quantities. Third, right condition. Fourth, right place. And fifth, right cost. These are the 6 rights of logistics management. I think I've left out the 6th one, which I'm giving you just now. And the last one is at the right time. So these are the 6 rights of logistics management: right goods, right quantities, right condition, right place, right cost, and at the right time. Part C, using appropriate examples, identify and explain 3 levels of management. The 3 levels of management, we have strategic management level, which is the topmost. Number 2, we have tactical management, which is the middle management. We have the operational management, which is the lower management. So strategic management, senior management role; tactical management, which is middle; and operational management, which is lower level. Now, to give examples in the clinical areas, strategic management, this is where you have people who come up with strategies for the organization. When it comes to nursing, this is where we have the SMS, the senior medical superintendent. This is where we have the principal nursing officer. This is where we have the financial accountant, the senior people who come up with strategies in terms of the resources, whether human or financial, or even the work itself. Then we have the tactical management. These are the people who come up with tactics which are going to be used in the different departments. For nursing, this is where we have our matrons. So we can have matron for pediatrics, matron for mother and child. We've got matron even for medical wards or for surgical ward. So the matrons are middle management, and these are the ones who come up with tactics that are used in the delivery of the service. And then we have the lower level, the operational management. This is where we have our sisters in charge, those who are working in direct control with the workforce. These are the shop floor managers, if I'm to use another term. So this is where we have the sister in charges being in charge of nurses in different areas. So operational management, this is where they are involved in the day-to-day operations of the ward, the nursing care, taking patients to theater, making sure they're given painkillers, making sure that they get their dressings done on time, making sure that they are admitted and discharged on time. These are all parts of the nursing process, which is managed or supervised by the operational managers, who are the sisters in charge. So these are the 3 levels of management and the examples that we have for all the 3. Strategic, principal nursing officer or chief nursing officer; tactical, matrons for specific divisions; and operational, this is where we've got the sisters in charges. Now we move on to part D. With aid of a well-labeled diagram of logistics cycle, explain the major activities in the logistics cycle. With the aid of a well-labeled diagram of a logistics cycle, explain the major activities of the logistics cycle. In this question, you are expected to draw a diagram, and you're supposed to get marks from that diagrams. And the diagram is the one which is just coming immediately now. This diagram is composed of different sections. we have at the center LMIS, which is Logistic Management Information System. Below it, there is pipeline monitoring. Below it, there is organization and staffing. And below it, we have budgeting. Then we have supervision, and we have evaluation. So this is the coordinating center, which means in our setup, if you're working in a local health center, this is more like at the district level, at the center. If you're working in a provincial setup, this is like at the headquarters. So we have other parts of the logistic cycle, as you can see. On top, we have serving customers. This is where we have our customers who are using the consumables that are involved in the logistics. The example I'm going to use in this particular explanation is that of BCG vaccines, where on serving customers, this is where we have mothers who bring babies to clinic for the BCG vaccines. So this is where they are served. But as the nurses or healthcare practitioners are serving these people, there is monitoring. They work with budgets. There is evaluation, which is done by the center, which can be the district level, which can be at provincial level, which can be at national level, which is depicted at the center. So in serving customers, there's also quality monitoring, which is done. But when we give these mothers, these babies vaccines, these babies who are brought by their mothers vaccines, we have these vaccines running out. They get finished. What do? We need to order some more. So we need to select the product that we need. So which vaccine has run out? It's BCG. So we have product selection, which is done by the responsible person at that facility. Of course, with monitoring, following budgets, and with supervision from the center. Then after selecting the product, the next thing is we need to quantify how much of this BCG do we need. This quantification is based on how much you are using, how much you used in the previous month. So you order enough quantities which is equal to what you used the previous month. But you also give in room for buffer stocks for other surges.